ligament collar মতো থাকে, it fits like a collar and the head passes down. This is called pulled elbow. The magic is that when mother pulls his girl child's hand, there is pulled elbow. But when mother pulls his boy child's hand, there is no pulled elbow. Similarly, when father pulls his boy child's hand, forearm, there is pulled elbow. But the father, pulling of father of his girl child never produces pulled elbow. কি বললাম আমি কথাটা? মা যদি মেয়ের হাত ধরে টানে, ঠিক আছে, তাহলে পুলড এলবো হয়। বাবা যদি টানে তাহলে হয় না, ঠিক আছে। বাবা যদি ছেলের হাত ধরে টানে তাহলে পুলড এলবো হয়, মা যদি ছেলের হাত ধরে টানে তাহলে পুলড এলবো হয় না। বোঝা গেল? এনিওয়ে, এটা আমি মিস করেছি। নাও টুডে আই উইল টক অ্যাবাউট দ্য রিস্ট জয়েন্ট অ্যান্ড দ্য স্মল মাসলস অফ হ্যান্ড, ঠিক আছে। রিস্ট জয়েন্ট ইজ অ্যান ellipsoidal joint between the lower end of radius and lower end of ulna, only the articular disc of ulna, and with the proximal row of carpal bone. We know there are 8 carpal bones. There are 2 rows of carpal bone, 18 number. What are the bones in the first row? What are the bones in the first row? That is scaphoid, lunate, triquetral, and pisiform. What is the second row of carpal bone? First class. Oh, very good. So the lower end of radius together with the articular disc forms a concave surface into which the convex surface of the first row of carpal bones fit. This is wrist joint. Together with there are other ulnocarpal joint which is with the articular disc of the ulnar, not the ulnar head, right? And there is distal radioulnar joint. There is distal radioulnar joint. That is the head of the ulna is articulating with the distal end of the radius. This is also included in the wrist joint, right? Draw the diagram. Draw the diagram. All right. The upper one is abductor pollicis brevis. The upper one is abductor pollicis brevis. The lower one is flexor pollicis brevis, and in between the two is the opponens pollicis. These three are thinner muscles. Ki bollam? The upper one is the abductor pollicis brevis, the lower one is the flexor pollicis brevis, and the middle one is opponens pollicis. All right. These two and this one, these two and this one makes the hypothenar muscle. This one is, first one is the opponens pollicis, next one is flexor pollicis, and this one is, digiti minimi. First one is opponens digiti minimi, second one is flexor digiti minimi, and this one is abductor digiti minimi. Right? So these are the hypothenar muscles. This one opponens pollicis, this one is opponens pollicis, and on the opposite side of each metacarpal bone, these two sides of the metacarpal bone are the dorsal interossei. With the two sides of the metacarpal bone, there is a ridge. For each metacarpal bone, there is a midline ridge, and the bone is carved. On either side, medial side and lateral side, the lateral side is wider, spacious. This area is wider and spacious. On both sides, there are muscle attachment, and in the middle, you see, in the middle there is also a red line. These are dorsal interossei, and in the middle, in this middle, there is also another muscle attachment. This is the site of origin of transverse head of adductor pollicis. This is the site of origin of transverse head of adductor pollicis, and all this in the middle, this gives rise to the origin of oblique head of adductor pollicis. Right? This point gives the insertion of the flexor digitorum profundus on the basis of the distal phalanx. On the basis of the distal phalanx, give rise to insertion of flexor digitorum profundus. Eigulo ki flexor digitorum profundus, and on either side of intermediate phalanx, these are the flexor digitorum superficialis. Eta flexor digitorum profundus or eta flexor digitorum superficialis. This is flexor pollicis longus. This one is flexor pollicis longus. This one is flexor pollicis brevis. This one abductor pollicis, and this one is adductor pollicis. All right. You have books. You will be able to compare this diagram with that one. This one, what is this one? This is opponens digiti minimi. This is flexor digiti minimi. This is abductor digiti minimi. And these corners are, bluish corners are piezohamate and piezometacarpal ligament. From the this is piezohamate and piezometacarpal ligament. All right. Now, from the styloid process of radius, we find radial collateral ligament. We find radial collateral ligament. This is the radial collateral ligament. This is like this. I have drawn is this to show you the attachment side. This is this, this is this. So radial collateral ligament and the ulnar collateral ligament. Radial collateral ligament comes from the tip of the radial styloid process and goes to the tubercle of scaphoid and tubercle of trapezium. Tubercle of scaphoid is this one, tubercle of trapezium is this one. And the ulnar collateral ligament comes from the tip of the ulnar styloid process and goes to the triquetral and PC4. Goes to the triquetral and PC4. Right? This is the basic architecture of hand muscles, small muscles in hand mostly. All right. And what you more need to know is about the palmar and dorsal interossei and about the ligaments of the wrist joint, palmar and dorsal interossei. In recently, what happened I don't know. The current books, the books of academic publishers and current books are differing in describing the interossei muscle. Even in the net, there is gross difference and gross anomaly between the description of palmar interossei and dorsal interossei. All right. Now the leg muscle or the lumbricals, this long tendon of flexor digitorum profundus, this long tendon, four long tendons of the flexor digitorum profundus, that is going to the base of the distal phalanx. And below that, in between the intermediate phalanx, there is insertion of flexor digitorum superficialis. Right? Remember, the flexor digitorum profundus has a function of flexing the terminal part of your finger. Flexing your terminal part of your finger is the function of flexor digitorum profundus. And other flexion, and the rest of the flexion of a digit is done by the flexor digitorum superficialis. And the palmar and dorsal interossei, they comes from the either side of the metacarpal, and its distal attachment is the base of the proximal phalanx. And this leg muscle goes, there is a superficial metacarpal ligament and deep to it is a deep transverse metacarpal ligament. There is superficial, have you seen dissection of hand? Whether dissection of hand is completed? Hand dissection হয়েছে? আচ্ছা, তো এইখানে স্কিনটা কাটলে, ঠিক আছে, you cut the skin and then separate out with 3 incision. You separate out the skin, then you will find the thick palmar interossei, palmar aponeurosis, triangular. This will be triangular palmar aponeurosis. At its base, there will be flexor retinaculum, rectangular shaped flexor retinaculum. At the base, occupying the distal phalanx. Wristed এটা proximal phalanx, এটা distal phalanx, right? দেখতে পাচ্ছ? এইখানে base of the thumb আর little finger, এইখানে একটা rectangular aponeurotic sheet আছে, that is called flexor retinaculum. And from there is a triangular aponeurotic sheet on the palm of the hand, right? If you cross the triangular area, you will find 2 ligaments, that is superficial superficial transverse metacarpal ligament, and deep to it is the deep transverse metacarpal ligament. তো দুটো লেয়ারে হলো, ঠিক আছে। and in between this 4 link muscle pass. Link muscle means these are the musculotendinous excretion process from the flexor digitorum profundus. 2 are unipinnate and 2 are bipinnate. There are 4 link. Why these are called link muscles? Because they connect the flexor muscles with the extensor muscle. When you move your hand, flexor and extensor are intercoordinate by the link muscle. Link muscle come as a short note. Link muscle একটা short note আছে, ঠিক আছে। So from the tendon of the flexor digitorum profundus, there are 4 worm-like muscles in between the superficial transverse metacarpal ligament and deep transverse metacarpal ligament, and goes around the digits. This is first one around the index finger, this is second one around the middle finger, then third and fourth around the ring and little finger. Got my point? This is 1, this is 2, another is 3, another is 4, right? And they goes to attach to the dorsal digital expansion, the hood that is formed by the both extensor and flexor muscle. That is called dorsal digital expansion, right? And that's why the link muscles can flex the metacarpophalangeal joint, and extend. They flex this and extend this interphalangeal joint. বোঝা গেল? ওই ডরসাল ডিজিটাল এক্সপানশনের সাথে অ্যাটাচড আছে বলে এই হুডগুলো আছে এই তোমার মেটাকার্পালের হেডের কাছে, ঠিক আছে। তো ওই ফর দ্যাট অ্যাটাচমেন্ট ইট ফ্লেক্সেস দ্য মেটাকার্পোফ্যালাঞ্জিয়াল জয়েন্ট অ্যান্ড এক্সটেন্ডস দ্য ইন্টারফ্যালাঞ্জিয়াল জয়েন্ট, ঠিক আছে। বোঝা গেল? কিছু বলবেন? অ্যাটেন্ডেন্সটা সিট আছে কিছু? কেউ আসুক, এসে একটু নিয়ে নিই। আপনি নেবেন? আপনি আসুন না, অ্যাটেন্ডেন্স নিই। আচ্ছা, ওকে। Due to ulnar nerve damage, when the link muscles are damaged, there is inability to perform this flexion and extension, the extension of the metacarpophalangeal joint and extension of interphalangeal joint. All right. And this gives rise to, if ulnar nerve is also damaged, this gives rise to number 1, ulnar clawhead, and the posture that is produced is this one. These two are supplied by the ulnar nerve, and these two are supplied by the median. The posture becomes like this. This is called hand of benediction, lekho, or preacher's hand. ঠিক আছে? Have you seen photography of Jesus in net? দেখবে ওর হাতটা যখন এরম করে আছে, ঠিক আছে, 2 are extended and 2 are flexed. Ring and little finger are flexed, middle and index finger are extended. This is done by link muscle, and these 2 are flexed because the link muscles are damaged for this, and or the nerve is damaged, that is the ulnar nerve is damaged. This is called hand of benediction or preacher's hand. এটাকে কি বলে? hand of benediction or preacher's hand. Now in the wrist, from the anterior surface of the radius, there is the dorsal radiocarpal ligament. Dorsal radiocarpal ligament is like this. Dorsal radiocarpal ligament is like this, going to both rows of the carpal bone. From here, it is going like this to both rows of carpal bone, right? And there is dorsal radiocarpal ligament. There is also dorsal radiocarpal ligament coming from the dorsal aspect of the radius and going to both rows of carpal bone. এইখান থেকে এটা হচ্ছে পামার রেডিওকার্পাল লিগামেন্ট, আর ঠিক উল্টো দিকে রিভার্স সাইডে এরকম করে উল্টো দিকে রয়েছে, ঠিক আছে, অন দ্য রিভার্স সাইড ইজ দ্য dorsal radiocarpal ligament, and other than there are the collateral ligaments and capsular ligament, right? I didn't draw the other component part, that is intercarpal ligaments, piezohabit or the piezometacarpal ligament. I didn't draw fully this ligament. All right, you should draw this, learn to draw this from book. বই থেকে দেখে এই লিগামেন্টগুলো কেরম করে আছে সেটার আইডিয়াটা তৈরি করবে, ঠিক আছে? In outstretched hand, when there is a fall, in outstretched hand, there is injury to scaphoid and lunate. There is injury to scaphoid and lunate. Most common fracture is the pollicis fracture. Most common fracture of the scaphoid is the pollicis fracture. There is a dinner fork deformity of the distal end of the radius. The distal end of radius goes to posteriorly and laterally. Distal end of radius goes to posterior and laterally. And there is like this. There is a dinner fork deformity like this. This is called pollicis fracture. And the reverse is called Smith's fracture. S-M-I-T-H'. That is called Smith's fracture. All right. Now, the scaphoid fracture, if the scaphoid fracture is through the waist, there is disruption of the blood vessels to its blood supply to its distal end. If the waist of the scaphoid is fractured, there is diminished blood supply to the, or interruption of the blood supply to the distal end of scaphoid, right? This is called avascular necrosis of scaphoid. Scaphoid fracture is again a short walk. Scaphoid fracture is again a short walk. Now, another injury is with fall in the outstretched hand is the dislocation of lunate. Dislocation of lunate. If the fall is dorsiflex hand, if the fall is in this position, dorsiflex hand, the lunate displaces. The lunate is displaced on the anterior side, right? Again, there is chance of avascular necrosis of lunate. Again, there is chance of avascular necrosis of lunate. Now, in scaphoid fracture, how will you know whether the fracture is there or there is only injury? কি করে বোঝা যায় scaphoid fracture হয়েছে? How do you clinically examine the patient to understand there is scaphoid fracture? কি করে বোঝে বাবা? We put pressure on the anatomical snap box. You know the anatomical snap box? You know it? Tightly extend the thumb and find there is a gap at the base. This is anatomical snap box. All right. There is a tendon on the lateral aspect. that is the abductor pollicis longus. With that is the extensor pollicis brevis. And the last one is the extensor pollicis longus. Abductor pollicis longus, extensor pollicis brevis, and the extensor pollicis longus. These at the base of the radius, where through the radial artery goes in, forming the deep palmar arch. এখান থেকে radial artery, এখান থেকে এলো radial artery এলো, এসে এই জায়গা দিয়ে in between the two heads of adductor pollicis, it will enter the wrist for going to form the deep palmar arch. It goes through this base of the snub box, right? So as it overlies the scaphoid, if you press this area, there will be pain. Okay, I will continue. Hand muscles I will continue. All right, thank you very much.